Wow. Jeez, Paul. I haven't slept in 48 hours and I can barely stand, and we talked about a trillion things. I'm probably going to repeat myself a little bit, but what we worked on together was, what did we talk about? And by the way, as you guys probably know, all these sessions over the last day and a half are recorded. They are going to show up in the Hint Health website here, just like last year's Hint Summit was. So all this content is going to be archived and free and accessible to everyone at all times, with one exception, which is Zubin's talk, because it's just too precious. He wouldn't let us touch it, and if we did, it would cost $1.2 billion, something like that. But so for people that watched that was pretty amazing. But anyway, so all the content's there, and inaccessible. Paul can tell us. Paul, when's it going to be on the website? I'm just kidding. We mainly worked through. There was a discussion about educating people on like the really kind of the fundamentals and basics of healthcare plan design, and like the differences between like what fully insured means and what self-insured means for employers, and those fundamental differences, and how important a benefit plan design is in getting things right. So some really good kind of basic understanding and mechanics on that for people that weren't familiar with it, because if you're a direct primary care doctor, you're probably not an expert on what benefit consultants do, but understanding what they do and understanding concepts of plan design are absolutely critical. So that was a big topic we went through. And then we spent a lot of time kind of just thinking through and kind of an archiving, and that session's obviously going to be recorded, but the Health Rosetta's website is going to have a lot of the output from that session as well. So everything here is fully designed to be consumed forever by people. But we talked a lot about practically like how do you actually start to catalyze a community, and bring people, who are the people in a community that you need to bring together to start to have a conversation about not just the healthcare system, but what Dave Chase had mentioned yesterday, but problems in communities. In the addiction crisis is probably a pretty good one as an example, that communities are very motivated to solve, or would want to get very motivated to solve, because fixing the healthcare system isn't really something people that get really excited about, and it's kind of complicated. But if you have a community that has a huge obesity problem, or has a huge addiction or opioid crisis problem, that affects a lot of families and affects communities broadly, and increasingly so. And that's a very motivated concept that a community can come together and rally upon. And by doing so, when you start to talk about, like, the first question is well, why is this here, right? Why do we have an opioid crisis? It starts to become very clear that, like, the current healthcare system is a huge enabler of the problem. So then the light bulb starts to go off. Well, that's what we really need to change, right? So it's kind of finding ideas that communities can rally against that are an outgrowth of a broken healthcare system that can motivate everybody in the community to say, well, that's the thing we need to fix, and I'm very motivated to do so because it's affecting my family and the families that I know. So that was a lot of what we talked about downstairs. Okay, so let's transition to our fireside chat. One stakeholder. One person in the room that really hasn't been talked about, but hasn't been represented in the discussion over the last day and a half is the patient, right? Isn't that what we're all here to try to actually help solve for? So this last chat is really a fireside discussion, and I'm going to have Dr. New, who is our fireside chat leader. He's actually a famous fireside chat leader, and he's had a lot of experience leading fireside chats. Explain to you what a fireside chat is. But he's going to be facilitating a discussion between Dr. Emilie Scott and one of her patients. Name again, I apologize. Jack Chance, who discovered, well, I'll let them tell the story, but so that the audience can start to understand, like, how a patient experiences DPC and what that difference is and why it's important. So with that, Dr. New, please take it away.
Thanks, Mike. So we need to get that fire going because I can't feel any warmth from here. But I have my...
Paul, fire, please.
Yeah. Come on, Paul. Come on. You're dropping the ball. At least we could get like a little cardboard cutout up here that, made it look like we had a fire closer.
We completely failed the fireside chat props. Could we noted that next year we're just going to be a blazing inferno?
Well, there's been several previous DPC events that had patients at them, and I think it's always one of the most dynamic and interesting and insightful things to have patients here. So, Jack, thank you for showing up here. And I think Mike said it perfectly. Like we get all excited about doctors and all the business of DPC, but I think we need to continue to remember that there's a patient across the table from the doctor, and they're the most important reason and the reason we're doing this. So, Dr. Emilie Scott and Jack, thank you for doing this. We have about 30 minutes here, so I kind of want to explore a few different things with them, but mostly centered around Jack's story, because we hear lots of doctors' stories, but not a lot of patients' stories. So I want to kind of focus on Jack's story. And yeah! Now if I could get some loafers and a bear rug up here, and preferably like a maroon jacket and a pipe and a glass of brandy. I know, I'm needy. So if we could focus around Jack's story. And I think where I would like to start is just hearing from you, Jack, about your previous experiences with healthcare, both pros and cons, and kind of what it was like for you to be a patient in all your previous relationships with primary care. We don't need to hear about all of them, but just what was your perspective about healthcare and primary care prior to meeting Dr. Emilie?
Well, basically, it was my previous doctor, working with him. First, let me tell you, I have medical conditions. I'm type 2 diabetes, and I have high blood pressure. Those are very prominent in my family. And so the doctor that I had primarily focused on medications and didn't really work on getting to the root of the problems and work on lifestyle changes and trying to work on getting healthy. And over time, without getting too much into the weeds, the job that I had was very stressful and long hours, 60-hour weeks. And I ended up putting on a lot of weight and got very unhealthy. And my doctor just kept increasing the medications. And usually when I met with him, I would go there and it might be a 30-minute wait to get into the room, the examination room, and then you might wait another 30 minutes there before the doctor came in, and then you would be with him for like 5 minutes, and then you'd be on your way. So I didn't really feel like I had I didn't have the access, and I didn't have, that partnership that I wanted to have with a doctor, and so I decided to look for another doctor.
Okay. So it sounds like in many respects it was a struggle for you. Do you recall any specific events or circumstances where you kind of went in with kind of an agenda or something you wanted to discuss or something you wanted to accomplish with your health where you didn't feel like that was possible, or that you didn't have enough time to do that?
Yeah, I felt like I felt like I have such short time with them, and when I went in to talk to him, I didn't really have an opportunity to really get into a lot of detail and really try to explore things with him. I didn't feel like that was really open. It was really more a matter of going in, looking at my blood work, doing listen to my heart and whatnot, and then basically, if he would make any changes to my prescriptions, and then we'd do that, and I'd be on my way. We didn't really have a lot of dialogue, and I didn't feel like that was, an option really to go in and have a lot of dialogue with them. Yeah.
And so, did you get a sense that was the physician was rushed or uncaring, or like what was your sense of the physician's role in all of that versus the system?
I felt like he had a lot of patients, and he didn't have a lot of time to spend with each patient.
Mm-hmm. And so you kind of reached a point, I guess, that you decided you wanted to do things differently.
Yes, okay. I really wanted to work on getting healthy, and I wanted somebody that could work with me and partner with me, and instead of just, I really wanted to get off the medications, really reduce them,
Yeah.
significantly. And so I said it was time to look for another doctor.
So when you made that conscious decision to, do better, be healthier, you
Right.
said you probably need a doctor to help you accomplish that. How
Exactly.
did you end up finding Dr. Emilie?
Okay, I got online and did a web search and went to Yelp and other websites, and Emilie popped out, and she just had
She does that
fabulous
from time
reviews.
to time. She just kind of.
She had a lot of reviews, and they were really fabulous. And reading the reviews, there was a lot of comments about how she's caring and how she really works, with her patients to try to actually come up with plans and help them, get on track to achieving, health.
So when
as
you were
opposed to-
when you were searching for a doctor, do you remember specifically what you searched for? Like, what did you Google? What was your?
Oh, it's been about 3 years, so
Yeah. Were you just looking for any primary care? Did you have an inkling of what direct primary care was, or?
No, I direct primary care, I thought of at that time was, this is something that if people don't have insurance,
Okay.
direct primary care would be possibly a good option for them. I have insurance,
Yeah.
I get insurance from the company that I'm retired from,
Okay.
I get pretty good insurance. But I really wasn't looking for DPC per se. I just wanted to find a good doctor that I would have access to and that would really work with me to try to help me achieve a healthier lifestyle, get me off of
So you
these
had heard of the
medications.
concept or phrase of direct primary care prior to reading about
Yeah, I
it?
had.
Okay.
I had heard of it. I just.
So you had some preconceived notions maybe
Right.
about what it is and who,
Yeah, I thought-
which patients might.
Yeah.
Yeah.
And-
But after you read the Yelp reviews, you thought, well, maybe that would work for me.
Yes, and then after I contacted Emilie, actually I went to her website and she had the website set up for Halcyon.
It's a very
Health.
pretty website. Right?
Yeah, very nice.
Yeah.
So I called the number and this very pleasant lady got on the phone and I didn't know. I assumed it was a member of Emilie's staff, and we talked for several minutes. And I says, "Wow," and she was telling me all about direct primary care, and that was when I was really getting the concept, it conveyed to me. And I says, "It sounds very interesting. I would really love to talk to Dr. Scott." And she goes, "Well, this is Dr. Scott." so
I've gotten
But,
that answering my own phone a few times before.
Yeah.
Yeah. So that was like the first, like, wow, this really is different.
Well, let me tell you, at the end of we talked for about half an hour, and I went down and I talked about all my medical issues and all the meds that I
You
was
mean
taking.
before you showed her an insurance card? She let you do
Before,
that?
yes.
Wow. That's
So I kind of laid it all on her, and she did a lot of listening, and at the end she said, you should really consider working on lifestyle changes and really work on trying to get healthy as opposed to just taking meds to
and that kind of fit with what
to stay
your goal was as well.
stable.
And so you decided to join the practice.
Yeah, I actually tried. I have an ophthalmologist,
Okay.
and I have to go see her every 3 months because of the diabetes, and she wants to make sure that I don't have the diabetic retina. However you pronounce it.
Retinopathy. It's a hard one.
Hard one. So anyway, and when I go to see my ophthalmologist, the first thing she asks me is, "What is your A1C?" And if I say, "I don't know because I haven't had it checked in a while, in over 6 months," then she would get very mean. She would chew me out. And so I had this appointment coming up with her, and I says, "I've got to get my A1C checked. Now's the time to change doctors. I really want to." So when I talked to Emilie, I was sold. I said, "I want to sign up, and I'm ready to do that." And she goes, "Well, unfortunately, we're not ready to do that yet. We're going to have our open house. Come in."
She wasn't open yet.
Yeah, she wasn't quite
officially open.
No, she didn't
Okay.
have her open house. She wasn't quite open. She invited me to her open house. So, and I says, "Well, I got this appointment with my ophthalmologist, and I've got to get
You
my
don't want
A1C
lashings.
checked.
You
I don't want to
need
get
more
chewed out
lashings,
again." And so she said, "Well, come on in and, for the open house, and we'll, she asked me when my appointment was, and it worked out. I was able to do that. So I went in and had the open house and met her in person and signed up, and it's been, I could say that it's been all upside. I can't think of any downside from going this direction. And
well, Emilie, do you remember the first time meeting him and chatting with him? What was your kind of perspective about when he came to you?
Well, so I was nervous because it was going from my large group HMO that I was with to starting this practice and being out on a limb. And I got a phone call from Jack, and he wanted to join the practice. And I was so excited that someone would take a chance on me and my husband and what we were doing together with our practice. So, and just really complimented to have that trust of someone to come join us.
Yeah. Did you get a sense that he was frustrated? Like maybe it sounds like because you had some previous difficulties with your previous doctor. Did he express any of that? I get that a lot as a...
Yeah, I think it was more a little bewilderment about kind of that that the doctor actually answered the phone and that I actually could take some time and we could talk about his medical issues on the phone. And that's been a recurrent theme when I get on the phone with people and really talk to them about their health. They are constantly surprised. The bar is very low for, all we have to do is get on the phone and connect to people, and people are blown away.
Yeah.
So.
Or tell them how much it costs up front or something else, it seems. And when you had your first visit with him and you went through that plan, do you recall kind of his response to that? Like it sounds like he was very receptive and kind of had already had an idea of where he wanted to be with his health, but do you recall that kind of first few visits with him?
He was just very excited to move forward. I think I felt very honored to meet Jack on this his path towards health, and felt really so grateful to be a part of that. So just felt good about having that time with him to motivate him and move forward.
When other than her answering her own phone, what are some other particulars that you've noticed difference in the way that she works versus previous primary care doctors?
Oh, as we went down this journey to achieving, health and well-being, which has gone on, it's almost 3 years. It's hard to believe it's been that long. But, I started off, I weighed 267 pounds. Not when I contacted Emilie. I had lost some weight doing low-carb dieting and what have you. But anyway, when I started working with Emilie, I had instant access to my doctor. I mean, I could send her a message on Twine. We use the Twine app, and which I think is fabulous, by the way. And also, I put in all my, my actual data would go in. My blood pressure and my blood sugars and so forth. And but just to be able to coordinate with her, to run things by her, and we also had not several, but we had some cases where there was urgency, where I had conditions that happened, and I needed a doctor
like that
right
day.
away.
Yeah.
There was, right.
Yeah.
But just to be able to actually have access to your doctor and communicate and
So with your previous experience with your chronic conditions, how often would you say you touch base with the doctor? Every 6 months, every year with your
Well, it was
diabetes
supposed to be every 3 months, but usually it was about every 6 months because I was busy and I didn't have anybody calling me saying you need to get in here and get your A1C checked or whatever, and
so maybe you wasn't staying on top of it quite as well as you should.
Right.
And what were some of the hurdles to doing that? I mean, you said you got busy, and was it just the difficulty in accessing them or communicating with them, or in terms of why you weren't staying on top of it as well as you should have?
Well, I think a lot of it again was the job I had. I had a very stressful job, and my last 7 years of my career was very, very tough, and a lot of long hours and whatnot, and yeah, you tend to focus on your career, not
Yeah.
not on your health.
Yeah,
You know,
for
and
sure.
that's basically what happened.
And how often, in that first year, did you think you touched base with Dr. Emily?
Oh, a lot, and I actually felt guilty because I thought I'm a high maintenance, and we had to do a lot of work to adjust my medications as I was dropping weight and I was getting healthier and doing more exercise and eating a lot healthier, and we had to make a lot of adjustments to my medications and try different ones, and so yeah, we were in contact all the time.
Like
I would say
every week, every month?
Oh, probably several times a week.
Yeah.
Initially.
Yeah.
Yeah.
And so I want to pipe in here because I think when you think about being in contact with all of your patients several times a week, I think that could sound quite intimidating. And from my perspective, what that relationship looked like was I would get a message from him on Twine, which I don't, I can check in my own time. I don't get beeped every time I get them, so I can batch my work. And it would just be his blood pressure, or I'm feeling okay tonight, or, my blood pressure is good today. And it actually, to me, made everything else less work, because that constant contact meant that when Jack was coming again and we were going to have a deeper discussion, I knew everything. So there wasn't this, we haven't seen each other or talked in a month, let's catch up and figure out what we're going to do. There was, we already know what's going on. It's so great to see you, and let's talk about your next trip. So, that really helped with the model to understand that even though it seems like you're doing more touch points with your patient, it's actually becoming more joyful and less overall work.
Yeah. The ability to, nudge people in the right, it sounds like you were already going there, but, instead of talking to someone every 6 months, you were talking or communicating in some way every week or more. So that's a big difference.
Right.
And do you think, it sounds like you were pretty determined and life circumstances changed and you were pretty determined to get healthy, but do you think if you would have attempted to do what you did with Emily with your previous doctor, how well do you think it would have worked? Like this, I'm really going to live right. I'm going to.
Well, I would have been on my own. I wouldn't have had help.
Yeah. And do you think it would have went as well?
It's hard to say. I don't. I was pretty motivated, but
Yeah.
but Emily was a huge help, and certainly there would have been issues with
Because you're on a bunch of medicines.
yeah, because we had to make adjustments to the meds, and we found other medications worked better in some cases, and we had to reduce the meds as we went.
Yeah.
And,
well, can you talk a little bit about the cost aspect of this? Because you mentioned you had good insurance, and I'll put that in quotations, and
yeah.
what that means to people means different things. But what was that in terms of your consideration of joining her practice and paying her versus your alternatives using your insurance?
Well, you also have to consider with the insurance. I have a pretty big deductible. I'm with Blue Cross Blue Shield, and I still have it up until next year. I go on Medicare because I'll be turning 65. But I have insurance from the company I retired from, and they have a deductible. I think it's like $350, and then you always have copays. Even going to your primary care, you have to pay a copay. And so when you think that offsetting it, it really is. It's very little money, and even if I didn't have those, it's well worth the money for me. For my situation, money is not an issue at all.
Yeah, yeah. But you considered that as part of,
I considered it
value.
I thought it was very affordable. I thought that was a good, what she's charging is definitely worth the money, especially after, the experiences we've had together.
Yeah, great. And what do you tell other people, your friends, family, about what Dr. Emily does? I mean, are they curious when you say, I get to message my doctor once a week, or, what do those conversations look like when you kind of tell other people that you're doing this thing?
Yeah. Well, my girlfriend is a huge fan of Emily's, and I tell her all of the conversations and things, and she's always saying, "Did you run that by Emily? What does Emily think of that?" And she did finally get to meet her, so they've met.
Yeah.
And Yeah, I tell everybody I can that
You're an advocate of.
I'm an advocate.
Yeah,
you know,
of
part
Dr.
of it is I have a great doctor, but a lot of it is the model, and I think it works very well.
Yeah.
You know, and if everybody could learn from, you know, the value that you have when you have that kind of interaction with your patients, and you can actually be a partner with them and really make them feel like, you know, that I hate to use the word friend because it should be it is a professional and, you know.
Yeah. Friendly.
But I really do feel like Emilie is a friend, and I think that, you know, just to have that kind of.
Well, I'm sure you're a persuasive guy, and everyone you tell about Dr. Emilie, they go and join her practice right away. But do you ever get like people who say, that wouldn't, you know, it sounds nice, but like, do you ever get like any negative or any like misunderstandings or that type of thing when you're talking to other people about?
Not really. I don't get negatives, no. I think it's more a matter of, you know, you have my friends, many of them, you know, are also retired from Boeing, and they have their own healthcare plans, and they're kind of
They think in that
entrenched
health
in
insurance,
that,
yeah.
and they just don't want to think about doing something different, you know.
Yeah.
But they also don't have, most of them don't have the medical issues that I had to deal with,
Yeah.
you know. So
Yeah. So you think about their insurance and the network, and that's kind of
right,
yeah.
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 So
Emilie, you mentioned something that Jack has given like a little presentation to your practice. How did that come about, or what did that look like?
Well, so part of our practice, we wanted to continue to provide value to our patients every month, so we do a monthly health seminar. And Jack said one day, I just want to talk about my journey on my health. Can I do that? And we said, great. So he came, and it was wonderful for us to see the experience of a patient in our practice and what he had taken from that and his perspective of his journey. So he really laid out where his health started, talked to us, you know, he started on a bunch of medications, and here are the changes that we made together, and now he's on very few medications, and showing how he changed his diet and helping motivate our other patients and form community around what ideas worked for him. And that was really valuable for our practice, to see someone else who's going through the struggle in our practice that had success and talk about their experience.
Yeah. Yeah. And that's not normal, I don't think, for doctors to let their patients get up and say, here's what my experience was. So were you a little bit surprised she let you do that? Or probably not, because she's so
I wasn't
nice.
really surprised. But I definitely
like the
wanted to.
ophthalmologist.
I wanted to.
Yeah, you're not the lash
Yeah.
for the ophthalmologist, yeah.
Yeah, I thought we had a very good story. Here I was, diabetic, and I had this long list of medications that I was taking. I'm now taking no medications, and the last time we had my A1C checked, it was 5.1. And my blood pressure medications are cut in half. We've cut those in half. So I'd say we've made some really good progress, and I really wanted to share that story, you know, so it was a great opportunity for me to do that.
Well, I can't think of a single thing negative about Emilie, but is there anything that you think that DPC at large or Dr. Emilie's practice could do different or better?
You know, I've tried to think
there
of.
wasn't any cons, but you couldn't come up with one.
I just couldn't come up with any. I'm sure if I thought hard enough, maybe I might, but it's hard to.
Well, I had to at least
yeah.
give you the opportunity to say
Yeah.
something that you could do better, but if you got
Yeah.
nothing, you got nothing.
can't
We have
really
about
think of anything.
5 minutes left, and I don't know if we have any mics or anything like that, but it's small enough room. Could we do some like audience questions, either aimed at Jack or Emilie?
I'm happy to give my mic too.
Yeah.
We could share a mic.
I don't. People call, and we have 2 employees now who answer the phone, but our message says if they want to contact me directly, they can push a number, and every patient has my cell phone. And I tell my patients over and over, you have to call me on my cell phone. And they rarely do. And like Jack, they feel guilty when they do. And for me, it's always a pleasure to hear from them because I know them, and it helps me feel that I'm providing value, and it helps me do a better job and feel like I know what I'm doing because I know what's going on with them.
I'd like to know more about the seminars that you do. Like, what topics do you do? Do you target your whole practice?
Yeah, so
or
we
certain parts, and which ones do you like to go to, and all of that?
We do them every month on topics that initially I was choosing them all based on what came up in the population. So sleep, nutrition. I mean, you guys all could come up with them, right? What else? Blood pressure, preventive screening. And then we started getting people from the community in. We had a PhD come in who is studying community and health and talk about how relationships affect us. We've had physical therapists, that trainer that Jack was working with, come and do some exercises, so on and so forth. And we stream them. So we do a video and then we send it out to our population because a lot of people don't want to come. So we will blast it out to them through a email campaign so they can watch it.
My name is Gitu Goyal. I'm a DPC doc in Houston. I'm right here.
Oh, yes.
Jack just mentioned that, when he was texting you on a weekly basis, he felt guilty that he was overutilizing. And I think as DPC docs, we have a little bit of that guilt also when people are paying us and not using us, right? And I don't know if there is a good answer to that, but I just kind of wanted to get some comments for maybe Ryan, Emilie, and maybe Jack as well. How do we handle those guilt feelings in a transaction like this or in a relationship like this?
That's such a great question, especially now, Jack came today to do this, and I was thinking, he hasn't contacted me in I don't know how long. It's been months. And then I see him here, right? And we haven't talked in so long, and here he is talking about how valuable this is, and what am I doing? So I think I do struggle with that. And in fact, we've been doing this for 2 years now, so we have people who've been with us and maybe have seen me once. And how do I get these people back? It's really important for me to do good work for them. So it's a great question. I think we're still trying to figure that out. And for me, it's meant bringing people in when on a yearly basis as much as I can get them to come. And knowing that every interface I have with a patient is that opportunity to prove my value. And I'm hungry to prove my value. You call me and I'm so glad because now I can do my job for you that you've been paying for. And now you're gonna be more interested in staying with me and being in my practice for the years to come because that's really where the heart of it is. And people are so grateful. Even, one interaction can last for so long for people because they just don't forget that you really do care.
I think it was Yogi Berra that said, you don't need access to a good doctor until you do. And that's like how I view this, that my job and our job is to move people into a better place where they need less of us. But that doesn't detract from why we're doing what we're doing. And so everyone's health is going to be a trajectory, and it's going to have some peaks and valleys. And there's times where, maybe 6 months or a year where a patient doesn't need us, but whenever they do need us, they know that we're available. So, what do you think about that? You haven't used her as much, so you obviously in the beginning were using her more. So what do you think about that? You were guilty in the beginning, but now do you say, well, I don't contact her as much as I should?
I don't know if it's a matter of I don't contact her as much as I should. We've done a lot of work, and I think I am at a place now where I don't need to talk to her as much, but I certainly, things do come up, you know. It wasn't that long ago, I had an episode where my pulse rate was racing, and I immediately contacted her, and we worked through it, and got it resolved. And if I do have something that I'm going to change, I made a lot of changes. I made a lot of changes to my diet. I talked to her about different dietary things, and but at this point, I just haven't had a lot of.
Yeah. Well, that's awesome. That's where we want to get people.
Yeah, and that was kind of the goal: get to the point where, she's there if I need her, but.
Yeah. Awesome.
Yeah.
Well, our clock says 0.
So.
And the fire is winding down, I believe.
Okay.
There's just embers, and we all have to go to bed. So thank you, guys. See you in the back.
Thank you.
Thanks, Jack. Thanks, Emily. Dr. You guys can sit there if you want. I'm just going to close it out. I mean, they're really comfortable chairs, so it's just nice to be able to sit. So, guys, I'm going to wind it up. Here's what I'd just love to do. Everything we do at Hint is completely driven by you. That's how we operate. And so I want to take like literally 2 or 3 minutes here, max, because I know we're looking outside. It's a beautiful day in San Francisco, and you want to move on, to get some audience feedback. So simple structure. Love it if for people to share things that they thought were good about Hint Summit this year, things they thought that were bad about Hint Summit that we could do a better job on, and any ideas that you have quickly to make it even more ideal next year. So just literally 5 minutes for things that come to mind immediately for people. There's a gentleman in the back there. Oh yeah, we've commandeered all the mics up here.
First of all, I'd say it's been a great conference for networking, lots of new ideas. And when you come away to a conference, you get pumped up and then you go back and hit the wall. And I'm just wondering if there's some way of creating a learning community amongst this group. And one idea would be doing a needs assessment of what people are most interested in, but thinking about like a monthly webinar where somebody might do a podcast on the thing that's what people want to learn about. You have some reading materials, and that the webinar is just Q&A. It's just a conversation with that particular person who has an area of expertise. That would keep, the embers alive for me until next year.
Excellent suggestion. Anybody else? Good, a bad, an ideal, a suggestion?
Well, bad is the size of the coffee cups.
Very good. Excellent. It can be as...
I almost left. I was just totally disgusted by that. This is kind of the next level of conference for me. I've been going to a lot of these conferences. A lot of us, the longer you do it, it's kind of like, I'm just going here to be social now because I'm not going to hear anything that I need. Or I might hear some stuff and glean a little bit of stuff, but you've done it for 5 years and you're in a different mode. But this conference has been very different because it's been much more focused on, a lot of the stuff with employers, a lot of just clinicians spouting our religious fervor for DPC. It's not about that. We are. I was talking to somebody. Right now, we were picking up gold off the surface. Now we have to dig into the ground and learn how to do that. And pretty soon we're going to have to learn to do serious mining to continue to do this. And I think our educational structure needs to continue to grow. And you guys did a great job of focusing on that in this conference, I'll just say.
Excellent. Jamie?
Okay, so maybe I had a hard time choosing track 1 or track 2 because I am already established as a physician with my own direct primary care. And so I'm at a certain level, but I do need to continue to grow and change. And so that was hard, but there are some educational things that I need to understand better, like about what is a self-funded employer. And perhaps I'll be able to watch that on video, and that was in track 2. But if it wasn't in track 2, I think the physician part of your audience, some of us need a little more education or ways to find out how we can educate ourselves to get to the level where we understand the kinds of acronyms that are thrown around by people on the stage. I'm just at the early end of that, so I just need more help there. So
Awesome. That's a really good suggestion.
My comment's more around like what was mentioned earlier in terms of how do we capitalize on this moment and carry that forward? Like, how do we have not just inertia, but actually momentum? And I feel like the tools are in place, and I'm just kind of want to challenge the whole community to use the tools that are in place. There's a Hint community, and I myself have not been very active in that. And I think, it's there. If we can take this opportunity and kind of commit to using it to be a place where the industry, brokers, Like when we have a question about a self-funded plan, we have somebody that can answer that. Because in our local communities, we personally do not have anyone that is DPC aware. And so coming here and developing the network, and then if we can take that same network and all of us commit to helping each other in a community, because this is the most collaborative group of people I've ever been a part of. You know, it's pretty impressive. And the amount of talent, if we can just kind of carry that where it's not a once a year event, we've got an ongoing Hint Summit online where we can communicate. And that's
Good.
just a suggestion.
Yep, good. There's a theme obviously presenting there. Did you have a question? Okay, cool. Excellent. Anything else that's critical to share? Super. A total random, oh, sorry. We have people running around with mics back there. Dr. Flanagan.
Just a lot of good. Number one, the location is unbelievable. I've been in about every DPC event, and Hint always does it the Hint way. Thank you for doing it that way. I also want to echo the importance of bringing in other non-MDs to these events and learning from David, both the Davids, David Chase and David C., both David C's, I guess. The other thing I just would request from every Hint Summit here on out is that I get to see you play drums. Props, man.
We'll work on that for sure. Excellent. So just a couple parting thoughts. It's incredible to me the kind of the evolution that's happened between the last Hint Summit, which was the first one last year, and this one. As everybody's picking up in the room, you know, the goal of this event really is to bring together all the stakeholders that are starting to drive change and that influence the change that we're trying to have, whether it's providers, it's the benefit consultant community, it's employers, it's patients. You know, and we're lucky enough to have the opportunity to work with all of those segments, right? And everybody's heads down in their silos all year long, right? So I'm just so pleased, and I think that there's, you know, I can't wait to see what next Hint Summit's going to be, because there's so much evolution happening on a day-to-day basis by everybody in this room and beyond that's driving innovation out there. That'll be interesting to see what next year is going to be like and how that reflects in Hint Summit. So I hope you guys will join us for that. I think as we communicated earlier in the conference, so we have a date for that, April 26th and 27th. Paul, is that correct? Next year, so we can calendar that. We were a little late on announcing these typically, and I think this time of year is challenging, so hopefully that's going to be better. And with that, I just want to thank everybody for taking the time and coming from across the country and from all parts of the country to attend. Yeah, Nathan. So, Paul, just can you just kind of update us on how all the content's going to be shared?
All the content will be shared at summit.hint.com, and we will have the talks and the slides side by side so you can go through them at your leisure. That will be up in about 2 to 3 weeks from now.
And I think the very last thing, Jamie Glover, this is kind of a random thing, it's pretty interesting, but Jamie, she has kind of a
Okay,
prompt
so
announcement.
this is specifically for direct primary care physicians who are at least have started a practice. But we have a direct primary care physician, Sharon George, who's on our DPC Docs Facebook page. And she says, hey, Hint attendees, and she was sad she couldn't come. Jamie Dahlgren Glover, that's me, is driving up to visit me in Napa after the conference today, and you are welcome. We bought 5 acres on the west side of Napa last fall to do physician retreats. Love to have anyone who can make it up. We have 1 more guest room to sleep and lots more room where we can pull out camping mats if you want to stay over, or you could just, come tonight. She sent me pictures of her beautiful property, patio, trails. We're going to walk the trails. So I am going to rent a car from the concierge at the Hilton Financial District, and if you want to join in on that with me and drive up with me, you can do that. I can come back tonight or tomorrow morning, whatever you guys want, or get up there with a lift. So I have her info, so just coordinate with me if there's anyone else besides me and Rob Lamberts who are going to do this, because we are going to do this. All right, thank you. And good partner for
Awesome.
Hint in the future. Physician retreat in Napa.
Excellent.
Sounds good to me.
Where do you go to healthcare conferences? right? And things like that happen, right? You don't. Where you go to healthcare conferences where people are smiling and energized all day long, right? And you hear the word hallelujah more than, several times throughout the day. That's what's so great about this community. It's great to have you guys. Enjoy the rest of your weekend in San Francisco. Travel safe, and we'll be in touch.